Did you know that simple nightly habits could be silently making your prostate swell, affecting your sleep and quality of life? If you're over 65, this is the hidden enemy lurking in your routine that you need to avoid for better rest and long-term health. Imagine waking up multiple times in the night, feeling like you can't get comfortable and running to the bathroom constantly. It's frustrating, isn't it? What if I told you that certain habits you've been unknowingly doing at night might be the reason for this? In fact, after 65, your prostate naturally tends to enlarge. But there are habits that could speed this process up, making those late-night trips to the bathroom a nightmare. Number 1, drinking too much before bed. When it comes to getting a good night's sleep, many people overlook the impact of drinking too much before bed. While sipping on a glass of water or a cup of tea might seem harmless, it can actually interfere with your sleep in ways you might not realize. The issue is not just the amount of liquid you drink, but the timing of it. If you're consuming any fluids, even hours before going to bed, your body has to process them. This can cause you to wake up during the night, disrupting your sleep cycle. The real problem is that when you drink too much liquid close to bedtime, your body starts to process it while you're asleep. This triggers the need to go to the bathroom multiple times throughout the night. These interruptions, especially when they happen repeatedly, can leave you feeling restless and tired the next day. It's not just about one bad night either. This can build up over time, causing chronic fatigue. If this pattern continues, it could even have an impact on your overall health and well-being. Another important aspect to consider is that these frequent trips to the bathroom at night can put a strain on your prostate, particularly for men as they age. The prostate is a small gland that plays a role in urination, and when it's constantly under pressure from these nightly awakenings, it can enlarge. This enlargement, known as benign prostatic hyperplasia, BPH, can make the problem even worse. Essentially, drinking too much liquid before bed doesn't just affect your sleep. It could contribute to an ongoing health issue, leading to more trips to the bathroom in a cycle that's hard to break. What makes this problem even trickier is that it doesn't just happen if you drink a huge amount of water right before bed. Even small amounts of fluids like a cup of tea or a glass of water can cause this problem if consumed too late in the evening. While these drinks might seem soothing or relaxing, their diuretic effects can still trigger that need to wake up and go to the bathroom. So what might feel like a healthy habit in the evening could actually be sabotaging your sleep. One way to reduce this disruption is by being mindful of your liquid intake in the hours leading up to bedtime. A good rule of thumb is to stop drinking anything about 2 hours before you plan to sleep. This gives your body enough time to process the liquids and reduces the chances of waking up for those unnecessary trips to the bathroom. By following this simple habit, you'll likely notice a big difference in the quality of your sleep. You'll fall asleep more easily and stay asleep longer. But it's not just about avoiding water or tea. It's also important to avoid caffeinated or alcoholic beverages too late in the day. Both caffeine and alcohol can act as diuretics, which increase your need to urinate. Drinking coffee or an alcoholic drink in the evening might make you feel relaxed for a while, but as the effects wear off, it can lead to increased nighttime bathroom visits. This combination of factors can quickly turn a peaceful night of sleep into a series of frustrating interruptions. Ultimately, making small changes to your nighttime routine can lead to big improvements in your overall sleep quality. Reducing liquid intake before bed is just one of the many steps you can take to create a more restful sleep environment. By paying attention to how much you drink and when you drink it, you can ensure that your body isn't waking you up in the middle of the night. Over time, you'll find that your sleep becomes deeper, more uninterrupted, and more refreshing, helping you wake up feeling more energized and ready to face the day. Number 2, late night snacking. Late night snacking is something many people tend to indulge in, especially when they feel hungry before bed or when they are winding down from the day. However, eating a large meal or snack too late can have unintended consequences, both for your sleep and your overall health. The primary issue with heavy meals late at night is that they spike your insulin levels. When you eat a large portion, your body's insulin production increases in response to the rise in blood sugar levels. This can cause disruptions to your metabolism and affect the way your body manages energy. One of the key areas that gets impacted by eating large meals before bed is your bladder. When you consume a big meal, especially foods that are high in sugar or salt, it can put extra pressure on your bladder. This pressure can result in frequent trips to the bathroom during the night, which is something many people experience. The constant interruptions to your sleep cycle make it harder to get deep, restorative rest. It also affects your ability to stay comfortable through the night, as your bladder feels the need to empty regularly. Furthermore, the large intake of food can also have an effect on your prostate, particularly for men. Research suggests that eating certain heavy or fatty foods close to bedtime can trigger inflammation in the prostate. This may cause discomfort, making it harder to fall asleep or stay asleep without waking up due to the discomfort. So in addition to disrupting your bladder, the impact on the prostate can lead to further complications for sleep quality. To avoid these issues, it's important to rethink the timing and content of your meals, especially before bed. A big dinner or snack right before sleep puts your body into a heightened state of digestion. Your body becomes busy processing food when it should actually be winding down for the night. This can result in increased heart rate, feelings of discomfort, or even acid reflux, making it harder to get a peaceful night's sleep. Instead, it's a good idea to opt for lighter, easily digestible foods in the evening. Think about having a small snack that won't disrupt your digestive system. Foods like a handful of almonds, walnuts, or cashews provide healthy fats and protein without overwhelming your body. These snacks won't put as much pressure on your bladder and are less likely to cause nighttime trips to the bathroom. Another great option is a light salad. You can choose low-calorie vegetables like spinach, cucumber, or leafy greens, which won't be hard for your body to process before bed. Add a little protein like chicken or tofu to make it more filling, but keep the portions modest. A small, well-balanced salad is not only soothing on the stomach, but also keeps your blood sugar levels steady, which means you're less likely to experience the spikes and crashes that come from heavier meals. By making smarter choices at night, you can maintain a more relaxed digestive system, allowing you to enjoy uninterrupted sleep. Keeping meals light and focused on wholesome, easy-to-digest foods can significantly reduce the strain on your bladder and prostate, leading to a more restful and comfortable night. By taking these simple steps, you can improve both your sleep quality and your overall health in the long run. Number 3, alcohol consumption at night. Drinking alcohol in the evening might seem like a relaxing way to wind down after a busy day, but it can have some unintended effects on your sleep and body. Many people don't realize that alcohol is actually a diuretic, which means it increases the amount of urine your body produces. While this may not be a problem during the day when you're up and about, it can cause a lot of trouble at night. As alcohol encourages your body to flush out more liquids, it leads to frequent trips to the bathroom, often interrupting your sleep. The more you drink, the more likely you are to wake up during the night to relieve yourself. These interruptions might seem minor at first, but they can add up to disturbed rest, leaving you feeling tired and groggy the next morning. A good night's sleep depends on staying in deep, restorative sleep cycles, and alcohol can disrupt this process. It may help you fall asleep faster initially, but it interferes with the deeper stages of sleep that are essential for your body to repair and recharge. This means that even if you manage to fall asleep quickly after a drink, you may not experience the quality sleep you need. Your brain won't enter the deeper, more restful sleep phases, and this can leave you feeling unrefreshed, as if you've barely slept at all. As a result, you may wake up with less energy, struggling to focus and get through the day. It's important to remember that alcohol not only affects your sleep patterns, but also influences your hydration levels. Since alcohol promotes urination, it can dehydrate your body, leaving you feeling thirsty, which might make you want to drink even more liquids during the night. This creates a cycle where you're constantly running to the bathroom, preventing you from staying asleep for long stretches. If you're trying to improve your sleep quality, one simple change is to limit or completely avoid alcohol at night. You don't have to cut out alcohol entirely from your life, but being mindful of when you drink can make a big difference. Instead of reaching for a glass of wine or a cocktail before bed, consider switching to a soothing, caffeine-free beverage. Herbal teas like chamomile are a great choice because they have a calming effect on the body and help prepare it for restful sleep. Switching to a warm drink at night not only keeps you hydrated, but also signals to your brain that it's time to wind down and relax. Chamomile tea in particular has been shown to have mild sedative effects, which can help calm the nervous system and promote a more peaceful sleep. Drinking something warm can also be a comforting ritual that signals to your body that it's time to relax and prepare for the night ahead. By choosing alcohol-free options in the evening, you give yourself the chance to experience more consistent, deeper sleep, leading to a more refreshed and energized morning. So, next time you're thinking about winding down with a drink, consider how it may affect your sleep quality and opt for a soothing, alcohol-free beverage instead. Number 4. Stressing before bed. The way you wind down before going to sleep plays a significant role in both your mental and physical well-being, and it's something many people overlook. If you've ever noticed that you're unable to fall asleep after spending time on your phone, watching an intense movie, or having a heated conversation, there's a reason for that. Engaging in stressful activities right before bed can actually have a negative impact on your body, especially when it comes to managing stress. When you're exposed to stress, particularly late at night, your body's natural reaction is to enter a fight or flight mode. This is an ancient survival response designed to keep you alert in case of danger. However, in modern life, we don't need to be on high alert when we're checking emails or watching a crime thriller. Instead, what happens is that your body starts to release stress hormones like cortisol, which makes it harder to relax and sleep well. High levels of cortisol don't just affect your ability to sleep, they can also impact your overall health, including prostate health. Cortisol is linked to inflammation, which when elevated for long periods can contribute to various health issues. Chronic stress and high cortisol levels can potentially affect the prostate, as stress tends to exacerbate inflammation in the body. This can make it harder for the body to repair itself overnight, which is when most of your body's healing and rejuvenation happens. To protect your health, it's essential to shift away from stressful activities before bedtime. This doesn't mean you need to eliminate all evening activities, but making conscious decisions about how you wind down can have a huge impact. Instead of diving into work emails or scrolling through social media, think about engaging in activities that calm the mind and body. This can be as simple as reading a good book, practicing light stretching, or taking a warm bath. Deep breathing exercises are also a great way to prepare your body for sleep. The simple act of breathing deeply and slowly signals to your body that it's time to unwind, activating your parasympathetic nervous system, which calms your heart rate and lowers stress. Many people find that practicing a few minutes of mindfulness or meditation can ease the transition into sleep by quieting the mind. Additionally, creating a soothing environment can enhance your ability to distress before bed. Dim the lights, turn off the screens, and consider playing some relaxing music or nature sounds. If you have the time, journaling can also be an effective way to clear your mind of the day's stresses. Writing down your thoughts helps to release any lingering tension and prepare your mind for a peaceful night's rest. Remember, good sleep is crucial for maintaining a healthy body, and that starts with managing your stress. A peaceful, calm, pre-sleep routine doesn't just help you sleep better, it also reduces the impact of stress on your health. By prioritizing relaxation before bed, you can lower your cortisol levels, improve your prostate health, and wake up feeling more refreshed and rejuvenated. Number 5. Sedentary behavior before sleep. Sedentary behavior, particularly before sleep, can be a hidden factor that affects your overall health. When you spend long hours sitting, especially in the evening, it can have an impact on different parts of your body, including your pelvic area. Prolonged sitting puts pressure on the muscles and blood vessels in this region, restricting proper circulation. This lack of movement can lead to a number of issues, one of which is the potential development of prostate problems. Over time, this pressure can become more noticeable and contribute to discomfort or a sensation of urgency and frequent trips to the bathroom, especially as you get older. For many, the evening hours are a time to relax, often spent in front of the TV or reading a book. However, sitting for long stretches of time without any movement can increase the risk of health issues. When your body remains in a fixed position for too long, circulation slows down and blood flow to certain areas, such as the pelvic region, can become restricted. This can lead to a feeling of heaviness or discomfort, which can worsen bladder issues like urgency and frequency. The pelvic floor muscles, which play a key role in bladder control, can also weaken or become tense from being in one position for too long. The good news is that you don't need to make drastic changes to your routine to combat the effects of sedentary behavior. Small adjustments, such as incorporating light movement into your evening, can have a significant impact on your health. Instead of staying seated for long periods, consider standing up every 30 minutes or so to walk around your home. This doesn't have to be an intense exercise. Even a brief stroll from one room to another can help improve circulation and relieve pressure in your pelvic area. Gentle stretches can also be highly beneficial. Stretching helps relax tight muscles, including those around your lower back and pelvis, improving flexibility and blood flow. By gently stretching in the evening, you can not only help reduce tension in the pelvic region, but also promote better relaxation before bedtime. This helps alleviate any discomfort that may have built up during the day, potentially reducing the likelihood of nighttime bathroom visits. Another simple yet effective way to counteract the negative effects of sitting for long periods is to engage in activities that promote circulation and overall well-being. Light exercises such as walking, stretching, or even doing a few yoga poses can work wonders for your body. These activities stimulate blood flow, encourage muscle relaxation, and provide a break for the muscles that may have stiffened from sitting too long. Making these activities a part of your evening routine can help prevent the discomfort and health problems associated with sedentary behavior. Taking a break from sitting is especially important as you get older. As the body ages, its natural processes slow down, and certain functions, like circulation, may not be as efficient as they once were. This is why it's crucial to keep the blood flowing through your pelvic area by engaging in light movement. Even if you don't have time for a full workout, small movements can still make a significant difference in how you feel, especially in terms of bladder control and prostate health. Ultimately, the key is consistency. By incorporating light physical activity into your evening routine, you not only help improve circulation, but also support your overall health. This simple habit can contribute to better sleep, reduce the risk of developing prostate issues, and help manage symptoms related to bladder urgency and frequency. Number 6. Poor sleep posture. Poor sleep posture is often overlooked, but it can have a big impact on our health, especially when it comes to the prostate and bladder. When we sleep in positions that don't support the natural alignment of our spine and pelvic region, it can cause unnecessary pressure on these areas. This pressure can lead to discomfort, pain, or even worsen nighttime interruptions like frequent bathroom trips. It's not just about how comfortable you feel when you first fall asleep. It's about how your body stays aligned through the night. If your spine is not in a neutral position, other parts of your body have to compensate, which may cause more harm than good over time. When you sleep on your back, for example, it may seem like a good position at first, but it can create pressure on your bladder and prostate. The weight of your body on your lower abdomen can lead to a sensation of fullness or even urge you to wake up multiple times during the night to use the bathroom. That constant interruption can interfere with your deep sleep and leave you feeling restless and unrefreshed in the morning. Another common issue arises when people sleep on their stomachs. This position forces the spine into an unnatural curve, which not only adds stress to the back and neck, but can also shift the pelvic area in ways that increase pressure on the prostate and bladder. This may not seem like a big deal in the short term, but long-term poor posture while sleeping can result in chronic pain, discomfort, and worse, an increase in frequent night awakenings. The most ideal sleeping position, especially for those concerned about prostate and bladder health, is sleeping on your side. This position naturally aligns the spine and helps distribute body weight more evenly. When your spine is in a good position, it reduces the strain on the lower pelvic region, which in turn alleviates pressure on the prostate. This simple adjustment can go a long way in ensuring a more restful night's sleep without frequent interruptions. To make such sleeping even more effective, many people find that placing a pillow between their knees is incredibly helpful. The pillow helps keep the pelvic area aligned properly, ensuring that your spine stays in a neutral, balanced position. This not only provides extra comfort, but also helps prevent any unwanted pressure from building up on your bladder or prostate. It's a small change that can make a noticeable difference in your quality of sleep and overall comfort. It's also worth mentioning that finding the right pillow is crucial. A pillow that is too thick or too thin can affect the alignment of your spine, which may end up causing more harm than good. Experimenting with different pillow types and sleeping positions is key to discovering what works best for you. The goal is to minimize discomfort and pressure on sensitive areas like the prostate, and everyone's body responds differently to different sleeping habits. In the end, experimenting with your sleeping position and making simple adjustments can significantly reduce nighttime interruptions. Paying attention to your posture during sleep is just as important as focusing on what happens during the day. By making small changes, like sleeping on your side with a pillow between your knees, you may notice a dramatic improvement in how well you sleep, how often you wake up at night, and even how you feel when you wake up in the morning. It's an easy yet effective way to prioritize both your comfort and overall health. Number 7, medications and their side effects. Medications are an often overlooked factor when it comes to managing prostate health, especially if you're experiencing frequent urination or disturbed sleep. Many people dealing with conditions like high blood pressure or anxiety are prescribed medications that can have unintended effects on their bladder and prostate. These medications, while effective for managing other health issues, can sometimes increase the frequency of urination or even cause a sense of urgency, making it harder to get a good night's sleep. If you notice changes in your urination patterns or feel like you're running to the bathroom more often than usual, it's worth considering that your medications might be contributing to these symptoms. One of the most common types of medications that affect the prostate and bladder are those used to control blood pressure. Certain antihypertensive drugs, like diuretics, work by helping your body remove excess salt and water through urination. While these medications are great for lowering blood pressure, they can also lead to more frequent bathroom trips, especially at night. This becomes particularly frustrating when it interferes with your sleep, leaving you feeling drained and tired in the morning. Medications used to treat anxiety and depression can also impact your urinary system. Some of these drugs, such as certain antidepressants or anti-anxiety medications, might cause side effects like dry mouth or constipation, which can indirectly affect your bladder. In some cases, these medications can increase the urge to urinate or cause difficulty in fully emptying the bladder. This can result in waking up multiple times throughout the night to visit the bathroom, disturbing your sleep cycle, and leaving you feeling unrested. Even medications that you might not think are related to urination, such as pain relievers or muscle relaxants, can have side effects that irritate the prostate or bladder. These types of medications often work by relaxing muscles, and if they affect the muscles of the bladder or the area around the prostate, they can lead to urinary problems. For example, opioids used for pain relief are known to cause constipation, which can, in turn, put pressure on the bladder and lead to more frequent or urgent urination. If you suspect that your medications are making things worse, it's important to talk to your doctor about it. Don't stop taking your medication without consulting them, as it could interfere with your other treatments. Instead, ask if there are alternative medications or dosages that might be better for you. Sometimes adjusting the timing of your doses, like taking a medication earlier in the day, can help reduce nighttime symptoms without affecting the overall effectiveness of your treatment. Your doctor may also suggest trying a different type of medication altogether or adding a treatment to help manage the side effects. For instance, if a diuretic is causing you to wake up multiple times at night, your doctor may recommend taking it in the morning instead of at night. In some cases, there may be medications specifically designed to ease urinary symptoms, such as alpha blockers, which help relax the muscles in the prostate and bladder neck, reducing the urge to urinate frequently. In the end, the key is to stay in close communication with your healthcare provider. They can help you find the right balance between managing your health conditions and minimizing unwanted side effects. It's important to be patient and proactive in discussing any changes in your symptoms so that together you can make adjustments that will improve your overall quality of life and help you get a restful night's sleep. Taking care of your prostate health while ensuring a good night's sleep doesn't have to be complicated. By making small adjustments to your nighttime habits, you can protect your health and enjoy a more restful sleep. It all begins with what you consume before bed. Try to cut back on liquids in the evening, especially close to bedtime. Drinking too much can lead to frequent bathroom trips during the night, disrupting your sleep and affecting your overall well-being. Staying hydrated is important, but adjusting your intake in the hours leading up to sleep can make a noticeable difference in how well you rest. Another helpful tip is to eat lighter meals in the evening. Eating a large or heavy dinner before bed can cause indigestion, heartburn, or discomfort that may keep you up. Opt for smaller, lighter meals that are easier to digest. This can also help prevent any unnecessary pressure on your bladder, making it easier to sleep through the night without interruptions. Focus on foods that are gentle on your stomach and consider avoiding spicy or rich dishes that might cause discomfort as you wind down. Alcohol might seem like a good way to relax at night, but it can interfere with your sleep cycle. While it might help you fall asleep faster, alcohol actually disrupts the deeper stages of sleep, causing you to wake up feeling tired and unrested. It can also make you visit the bathroom more often during the night. If you're aiming for a restful night, try cutting back on alcohol in the hours before you go to bed, or consider finding other ways to unwind that don't interfere with your sleep. Managing stress and anxiety is another key factor in achieving restful sleep. Stress can make it difficult to fall asleep, and when you do finally manage to drift off, it can cause you to wake up throughout the night feeling restless. Try implementing relaxation techniques before bed, such as deep breathing, meditation, or stretching. These activities can help lower your stress levels and prepare your body for a peaceful night's rest. A calm mind is essential for a good night's sleep, so taking time to unwind can work wonders for both your sleep quality and overall health. Staying physically active during the day is also important for better sleep. Regular exercise helps to regulate your sleep patterns, making it easier to fall asleep and stay asleep. Just be careful not to exercise too close to bedtime, as it could have the opposite effect and make it harder to relax. Try to incorporate daily movement, whether it's walking, yoga, or any other activity that keeps you moving and helps reduce stress. A well-balanced exercise routine promotes better health and ensures that your body is ready for rest when the time comes. The position in which you sleep can play a significant role in how well you rest. For example, sleeping on your back can put unnecessary pressure on your bladder and prostate, leading to frequent nighttime trips to the bathroom. Experiment with adjusting your sleeping posture to find what works best for you. Sleeping on your side may alleviate some of this pressure, helping you sleep more soundly throughout the night. It's a small change, but it can have a big impact on your overall comfort and sleep quality. Finally, take a moment to review any medications you're taking, as some may interfere with your sleep or cause issues with bladder control during the night. Certain medications can have side effects that affect how often you need to get up in the middle of the night. If you notice that your medication is affecting your sleep, talk to your doctor about potential alternatives or adjustments. Taking control of your medications can help ensure that you're not only improving your prostate health, but also getting the restful sleep you deserve. By adopting these simple changes, you can protect your prostate health and enjoy a more restful, uninterrupted night's sleep. It's all about making mindful adjustments to your routine. With a few small tweaks, you'll be able to wake up feeling refreshed, recharged, and ready for the day ahead. So take charge of your nighttime habits, and your body will thank you with better sleep and improved health.